Hi, welcome back to Surgically Speaking. I'm Dr. Nitya. In today's video, I shall show you how to give injection Keloid, which is a long-acting steroid, into a keloid for its management. But before that, for the benefit of my students, very often in your exams you will be asked the difference between a keloid and a hypertrophic scar. I shall tell you 4 or 5 differences. Try to remember this. Number 1, a keloid always extends and grows beyond the wound margins. Hypertrophic scar never does that. Number 2, on appearance, keloids appear as raised, shiny and nodular irregular lesions, whereas a hypertrophic scar appear as raised, shiny and smooth lesions. Number 3, the pain and itching and discomfort that the patient experiences in keloid is way more than that in a hypertrophic scar. Number 4, a keloid continues to grow relentlessly, whereas a hypertrophic scar halts after growing for a certain amount of time, and then it may even regress over a period of time. Number 5, the response to treatment is very, very poor in a keloid. The recurrence rate is very high. That's why we never try to operate on a keloid straight away. We resort to non-operative methods. Whereas a hypertrophic scar, they respond very well to management. And number 6, when you look at it through the microscope, there is excessive formation of collagen tissue and fibrous tissue in a keloid as well as in a hypertrophic scar. But in a keloid, the excess amount of collagen tissue is arranged in a haphazard manner, while in a hypertrophic scar it is arranged in a parallel manner, which is a very distinctive feature on histology. And finally, the type of collagen in both these things are type 1 and type 3, but the ratio differs. In keloids, type 1 collagen predominates, and in hypertrophic scar, type 3 collagen predominates. So these are the differences. Try to remember this and recall it during your examinations. And now we shall get into the video. I'll be showing you how to give injection Keloid into a keloid for its management. I'm sure you'll love it. This is a keloid. See, this person came to me with multiple keloids. See here, 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 here. And this is the pre-sternal region, the most commonest site for a keloid. Keloids are common in the pre-sternal region over the shoulder region. These are the places where keloids are common. We give injection, steroid injections. What I'm using is Keloid. This is Keloid injection, and that is given intralesionally. Now this person, this is my 4th dose. The patient is receiving his 4th dose, and you can see the beautiful response that he has to the injection. It used to be a very raised, huge keloid. Now it is nicely flattened out. Even the skin tone is returning. So he has come for the 4th injection. Thambi chinna usi valikade kathadinga. Yes. Now I am injecting it inside. Now it will be very tough, It is not an easy injection because of the excessive collagen tissue disorganized. There will be pain. The patient will have pain, so always make the patient lie down comfortably and then you should give the injection. You will have to use considerable amount of force. I am actually using a lot of force. You will not be able to make it out in the video. And if it is difficult, that means you are in the right plane. If it goes easily, that means you are beyond the margin of the keloid, and that is the wrong method of doing it. So, yes, now I have broken some fibers there, and now my injection is going freely. And now if it's going freely, I'm not going to inject further. I'll just choose another site. Yeah. Give me a gauze. Usually through the puncture hole, the medicine comes out. The maximum dose you can give is about 40 milligram. I am giving 40 milligram here. Chinna osipa. Yes, you can see this. My patient here is so comfortable. He is cooperating with me very nicely. But still, you need to be very, very gentle there, right? Constantly keep reassuring the patient. Chinna usikumbi. Keep reassuring and be very gentle. Don't ever be in a hurry. If you are in a hurry, you might be injecting in the wrong plane, and it is a waste of injection. Okay, you can see the amount of force I'm using. Yeah. Yes.